Okay. So we have your reticulocyte count. So can anyone tell me what is a reticulocyte? Ano ang reticulocyte class? Base sa naaalala nyo sa lecture. Yes. Young erythrocytes. Okay, they are young RBCs. Now, if you recall class, may mga stages ang RBC nyo, 'di ba? Pang ilang stage yung reticulocyte count, yung reticulocytes nyo? Pang ilang stage? If you recall. Second to the last. Okay, so your reticulocyte count class is the stage before your RBC. So retics, after na ng retics class would be your red blood cells. Okay, here's a question. What WBC would you compare your retics? Anong WBC class? Would you compare it to your reticulocytes? What WBC would you compare your reticulocytes? So, sabi nyo sa akin, second to the last siya sa RBC. So, ang reticulocytes nyo could also be found in the peripheral blood or the circulation. So, anong cell mo siya pwedeng i-compare na pareho sila? No, no, not monocytes. Okay, malapit ka na, Miss Pabingwit. Sige, kaya mo yan. Remember, we're talking about here young, bata. No, no, not nitroblasts. You can't find them in the, hindi mo sila makikita sa peripheral blood. Ano yung young WBC na nakikita nyo sa peripheral blood class? Hindi may yellow blast. Makikita nyo lang yan sa peripheral blood pag may leukemia yung patient. Hindi erythroblast, Mr. Season. I'm talking about WBC. Hindi erythrocyte. Anong WBC? Hindi. Naalala nyo si stab? Saka si band? Ano si stab? Ano si band? Di ba yan yung precursor? Precursor to your to neutrophils. So do remember that, ha? So they are the same as parang similar sila with your reticulocyte. So if you're gonna be asked in your quiz or in your exam, what cell would you compare your reticulocyte? It would be to your stab or to your band. Now, reticulocyte class are immature RBCs which had lost their nuclei but had retained aggregates of RNA. So, if you recall class, naalala nyo ba na as the cell matures, the nucleus or nuclear material is removed. Meaning, kapag younger ang cell, marami siyang increase ang nuclear contents niya. So if you would remember class, ang reticulocytes niya are young cells. These are immature RBCs that have no nuclei but they have retained aggregates of RNA. So, meron siyang RNA class na natira. Now, these aggregates of RNA are called your reticulum. Ang tawag sa aggregates of RNA na yan are reticulum and are stained supravitally. What is a supravital stain, class? If you recall our previous lessons sa lab, what does your supravital stain do? Live cells ang nasa so they are used in staining mo stain siya og kanang live cells. So staining of live cells. Natatawa ako, class. Just to share to you. Nung isang araw, kinausap kami nag-post yung sa faculty GC na kailangan English lang ang mode of instruction sa lesson. Nung nabasa ko yun, medyo na-bothered ako kasi alam nyo, when you're gonna teach something like this, ganito ka complicated, specifically yung mga medical terms, ituturo mo yan sa bata in English, in pure English, mahihirapan yung estudyante intindihin. So, ewan ko bakit naisip yun, kung bakit ba lagi ang College of MedTech na yung program nyo. Anyways, balik tayong topic. So, your supravital stain is used for the staining of live cells. And the younger the reticulocyte, the more filamentous and plentiful is the reticulum. So remember kasi class, di ba? Sabi ko nga, the more younger the cell is, the more nuclear content it would have. That's the reason why the younger the reticulocytes, the more filamentous and plentiful yung reticulum. And when I say reticulum, these are your aggregates of RNA. What does the word aggregate mean, class? Anong ibig sabihin ng aggregate? What is the word aggregate? Okay, mag-clumps, kumpul-kumpul sa Tagalog. So they would be clumping of RNA. Now, your reticulocytes class would stay in the bone marrow 3 days for maturation, and 1 day naman siyang magsisirculate in the peripheral blood. So sa again, bone marrow would stay for 3 days for maturation. So 3 days siyang nasa bone marrow para mag-mature, then it would circulate sa peripheral blood for 1 day. So pakitandaan yun, class, ha? 3 days sa bone marrow for maturation, 1 day sa peripheral blood to circulate. Then a cell may be considered a reticulocyte if it possesses 2 or more reticular dots. So sabi ko kanina, ang retics nyo would have aggregates of RNA. But there is an exception. If a cell possesses 2 or more reticular dots, considered reticulocyte siya. So example, class, ganito itsura ng aggregates of RNA niya. So you would consider this as a retic. Pero kapag ang cell nyo meron lang ganyan, these are your reticular dots. You would still consider this as a reticulocyte. Okay? So do remember that, class. It is not required. It is not required to have an aggregate of RNA. What is required is that if it only even if it possesses 2 or more reticular dots, it would still be considered a reticulocyte. Now, here are the importance of your retic count. To confirm the diagnosis of pernicious anemia. Class, what would cause your pernicious anemia? Ano ang nagko-cause ng pernicious anemia? If you would recall. What can cause pernicious anemia? Vitamin B12 deficiency. Very good. And what is the purpose of your vitamin B12? Para saan ang vitamin B12 class? Burp, excuse me. Anong nagagawa ng vitamin B12? What is the purpose of your vitamin B12 sa cells? Hala, nakalimutan yun na. Yes, it contributes to the structure of the RBC, but give a more specific answer, Ms. Torres. Hindi Miss Johnson. Sige, keep trying. Kaya mo yan. Uy, para sa yung vitamin B12 class. Hala, kinalimutan nyo na. Nagkaroon lang kayo ng simulator lab, nakalimutan nyo na yung aral nyo. Alam nyo class, yung sim lab nyo na 7 to 7, ganyan ang review center. So pagka-graduate nyo, magre-review center kayo, you have an option. I-share ko lang sa inyo yung experience ko. Nung college ako, I had a best friend na girl. Itong best friend ko na to, gusto niya mag-review center. Ngayon, ayaw niya mag-review center nang hindi ako kasama. So ako talaga, ang plano ko lang, self-study lang ako. Ayaw ko talagang gumastos ng 10,000 para sa review center. Anak ng kalabaw. Alam niyo, pinilit talaga ako, class. And ang start ng review namin, 7 a.m. Hanggang alas 5 yun ng hapon, nakaupo ka lang. Alam mo, na-realize ko after nung review center na yun, alam niyo ilang beses lang ako pumasok out of 22 meetings. Parang mga 5 lang. Tapos naisip ko, parang pala ako nagsayang lang din ng pera. Tapos, ayun, wala lang. So ang point ko lang, class, kapag mag-review center kayo, treat nyo na lang yung lab sim nyo as a training phase para pag nag-review center kayo someday. Kasi talagang wala kayong gagawin. You just have to absorb everything na ituturo ng reviewer nyo. Magsasalita lang na magsasalita yung reviewer nyo. Ang malas nyo lang, class, kapag naka-encounter kayo ng reviewer na nakakaantok. Yun talaga, mawawalan kayo ng gana. Anyways, back on topic. So, para saan, class, yung vitamin B12 nyo? What does it do to the cell? What part of the cell does it make it ano yung part ng cell niya na minamature niya? What part of the cell matures in vitamin B12? Hindi. Walang kang isipin yung him. Walang him. Mamaya ng him. Okay. Your vitamin B12 class is responsible for nuclear maturation. Kaya nga, di ba, kapag meron kang pernicious anemia, increase ang retics mo because you have abnormal nuclear maturation. Hindi makapag-mature, your reticulocytes aren't able to turn into RBCs. Okay? So, meron kayong abnormal nuclear maturation sa vitamin B12 deficiency. Now, it is also used to determine response of pernicious anemia patient to vitamin B12 therapy. So, what is the expected result, class, kapag nag-undergo na ng vitamin B12 therapy? Ano na ang magiging resulta ng reticulocyte niya? So, naggagamot ka na, binibigyan ka na ng supplement for vitamin B12. What would now happen to the result of your reticulocyte? Hindi. Naggagamot ka na, Miss Johnson. So, what would happen to the retics? Naggagamot ka na eh. So, it is expected na bababa. Di-decrease na ngayon yung retics mo. So, it is used to determine. So, let's say na nag-undergo na ako ng treatment for pernicious anemia. It is expected that from an increased reticulocyte count, bababa siya. Then it also aids in the diagnosis of lead poisoning and hemolytic anemia, and to determine whether there is normal RBC regeneration, and to aid in the prognosis of acute hemorrhage. Okay, there are two methods class of reticulocyte count. The first one would be your dry method, and your second one will be your wet method. Now, in the dry method class, blood is mixed with a supravital stain. Can you give me an example class of a supravital stain? Sample class ng supravital. Yung pinaka-common na tinuro ko sa inyo last time. Hindi right stain. Romanowski stain yan. Hysteris. Kompletuhin mo. Miss Talakan. May kulang ka na word. Kompletuhin mo. Kaya mo yan, Chin. Okay. So, yun yung new methylene blue. So, you would mix a blood is mixed with a supravital stain. Sa practice natin class, in your internship in the future, you would be using new methylene blue. Then, a smear would be prepared from the mixture. Then, smear is then counterstained with rights. So, counterstaining may not be done anymore. Reticulocytes are counted per 1,000 RBCs under OIO. Then, we have your wet method. A film of stain is spread on a glass slide and a drop of blood is added. The preparation is covered with a cover slip. Okay. Mamaya ko ipapakita sa inyo class yung dry method. Dito muna tayo sa wet method. Ito drawing ko na lang. This would be your slide. Tapos mag-a-add kayo ngayon ng stain. Kunwari ito yung new methylene blue. 1 drop. Then, after that, ikakalat mo yung methylene blue class. Spread mo in a circular pattern. Then, you would add your drop of blood. As in, drop of blood. Then, you would now add your cover slip. Then, you're required to count in both methods class 1,000 RBCs under OIO. In both methods, light microscope may be used. A calibrated disc may also be used. So, ituturo ko yung calibrated disc later. So, now let's proceed to your dry method. So, in your dry method class, in a test tube, kukuha kayo ng test tube, mag-a-add kayo ng 3 drops of EDTA blood. So, ito ang sample nyo sa reticulocyte count. Pag tinanong kayo, what is the blood sample to be used in your retic? It's your EDTA blood. So, 3 drops of EDTA blood plus 3 drops of your supravital stain. So, equal ratio of blood to stain. So, 3:3. So, 3 drops ng blood, 3 drops ng stain. Then, you're going to mix and stand for 15 minutes. Then, after 15 minutes, mix again, then make smear. Then, counter stain with right stain. Now, this is not technically not required. I will explain that later. Okay, here's a better visualization of your dry method. Now, sabi ko kanina, in a test tube, you have to add 3 drops of your methylene blue dye. After adding 3 drops of methylene blue dye, new methylene blue dye, you're going to add 3 drops of EDTA blood. Then, you're going to incubate it at 37 degrees for 15 to 20 minutes. Class, can anyone tell me the purpose? What is the purpose of your incubation or standing? Bakit kailangan i-incubate or i-stand yan? And bakit din 37 degrees? Anong meron sa 37 degrees centigrade? Any ideas? Pag makopy ang body temp para makita ang same pattern. So, ano meron sa body temp? Sige, tama. Medyo tama ka, Miss Chongson. So, sige, just to further help you explain, anong meron sa body temp? What is the relationship of body temp to your reticulocyte? Yung environment. Okay, better. Okay, here's a follow-up question. What temp would most cells survive? Anong temp? What temp would most cells survive? Anong temperature? Yan, tama yung sagot ni Miss Villarreal. To keep the cell viable. So, bakit kailangan viable siya? Ano ngayon kung patay o buhay? Bakit kailangan buhay yung cell? Sige, class, kaya niyo yan. Why do you need to keep the cell? Okay. Tama naman si Miss Villarreal. Class, remember, you are using supra-vital stain. Now, if the cell is dead, the stain won't be absorbed. Kailangan, class, it is required that your cell is alive so that the dye could be absorbed. Okay? So what's the purpose naman ngayon of the 15 to 20 minutes? Bakit kailangan i-stand siya or i-incubate? Ano ang purpose ng standing time or waiting time nyo kapag nagsistain kayo? Sa microbiology nyo class, if you recall sa gram stain, bakit kayo may mga waiting time? May 5 minutes, may 2 minutes. Para saan yung mga yun? It also has the same principle sa reticulocyte count. Or in any technique, in any staining technique, there is also a waiting time para mag-mix ang reticulocyte sa stain. Okay, pwede. So this is the time required class. Yung mga standing time nyo, incubating time, that is the time used for the cell to absorb the dye. To absorb the dye. So in 15 to 20 minutes class, kaya niyang i-absorb yung dye. But it is required at 37 degrees centigrade kasi nga you're using a supravital stain. So if the cell is dead, the stain won't be absorbed. Okay? So I hope you understood the purpose of the 37 degrees and the 15 to 20-minute incubating time. Then after incubation class, you have to suspend the cell by gentle mixing. So i-mix nyo lang yung tube. Then you make the smear on a glass slide. Okay. Sa internship nyo class, ganito ang mangyayari. Walang test tube. Hindi niyo yan gagamitin. Hindi yan ang ituturo sa inyo. Ang ituturo sa inyo, kuha kayo ng slide. Name ng patient, label. You're going to get a drop of blood and a drop of new methylene blue. Ihahalo niyo yan. After mixing, gagawa na kayo ng smear. Ito ang tinuro sa akin nung internship ko, ito ang tinuturo sa mga hospitals. Pero, I suggest, kapag kayo na yung nag-intern, try to do the tube method. Mas maganda yung magiging resulta nyo kasi there is equal mixture. Okay? So try to do the tube method, the dry method in your internship. Okay? Sa medtech. Wait lang class ah. Hindi ko na makita yung pangalan ko. Webinar on enhancing students' well-being. Alam po, nag-submit. Okay. Tuloy tayo. Okay, when dry examining the smears without fixing or counter-staining, choose an area where the cells are evenly distributed and staining is good. Okay, balik pala tayo dito, class. I forgot to explain something. Counter-staining, class. Counter-staining. Let's talk about counter-staining. Yung right stain nyo. Now, yung right stain nyo, class, ang purpose niyan is to visualize other cells. So since you're talking about reticulocyte count lang naman, ang request lang ng doctor, let's say, retic count lang yung nakalagay sa request, you no longer need to perform counter staining by rights kasi hindi mo naman titingnan yung RBC, yung WBC, or yung other cell. So you no longer need to counter stain it with rights. Okay na yung menu methylene blue. But then again, class, depende yan sa SOP ng laboratory nyo. May mga labs na they would require counter staining, may mga iba na wala. So it's up to you. But para sa akin on my own, if you're just looking for reticulocyte count, that is already more than enough. Okay, you're going to choose an area where the cells are evenly distributed and staining is good. Okay, before this, let me teach you, let's have a recall on your microscopy. Mag-ano tayo, class? Mag-microscope lang tayo saglit. So this is a virtual program that I use for teaching microscopy in my microbiology laboratory. So here we have, class, your standard microscope, your oil immersion, your cedarwood oil rather, your lens paper, and your... So let's have a recall, class. So which type of slide would you want? Plant, animal, bacteria, or human slides? Plant, animal, bacteria, or human? Ano gusto niyo? Human. Anong gusto niyo? Adipose, areolar, blood, compact, etc. Buto-buto or ano? Blood. Okay, so if you recall, class, what are the objectives in your microscope? Ano yung apat? Can you tell me what they are if you recall? What are the objectives, class? Ano yung mga objectives niyo? Okay, yun. Scanner, LPO, HPO, Okay. Itong eyepiece nyo, meron ba tong magnification, class? What's the magnification of your eyepiece? 10 times. Very good. Okay, you have two knobs, the coarse adjustment knob and the fine adjustment knob. Saang objective nyo gagamitin yung coarse adjustment knob? Saka, ano pa? Scanner lang? Scanner saka LPO. How about yung fine adjustment knob? Kailan nyo yung gagamitin? HPO saka OIO. Okay. So you would start class always at the lowest magnification. So start kayo sa scanner. So in the scanner class, you're going to adjust using the coarse adjustment knob. So iikot nyo yan. Till you view this. Yan. That was my light yan. Okay, once you've seen something, may nakita na kayo, you now proceed to your LPO. So, medyo madilim siya, class. I-adjust nyo yung light. Then, try to make it as visualize as possible. Then, you now move to your HPO. Now, yung HPO nyo, class. Oh my God, naglag. Wait lang. Naglag. Nagbabayad ka ng 2,100 a month pero wala pa rin kwenta ang internet mo. Only in the Philippines. Okay, balik tayo sa human, sa blood. Okay. So, scanner. Adjust the light. Transfer to your LPO. Adjust the light again. Then, you now move to your HPO. Now, in your HPO class, it would start usually dark. Then, you now have to adjust your fine adjustment till it becomes a bit finer. Finer yung nakikita mo. Then, ang sabi kanina, you try to find an area where there is equal distribution of cells. So, dito sa walang mapakita siya na maganda dahil dikit-dikit pa rin yung mga cells niya. So, nonetheless, this is just an example class. But you try to find equal yung distribution. Yung mga walang dikit-dikit class, there's no overlapping of cells. Then, move now to your oil immersion objective. Now, sa oil immersion objective nyo class, you are required to use cedarwood oil. So, you're going to put a drop of cedarwood oil on the slide. Then, i-transfer nyo na sa oil immersion objective. Then, adjust nyo na lang yung fine focus. Now, kapag ginalaw nyo class yung coarse adjustment knob ng nasa OIO, anong pwedeng mangyari? What might happen, class? What would happen if you suddenly adjust the coarse adjustment knob all of a sudden? Nag-blur? Sige nga. Di naman nag-blur eh. Ayun, may nakita ko. Mabasag yung cover slip. Yan, basag class. Ulitin natin. Sabi dito, you should avoid using the coarse focus knob in the 100 times objective. When adjusting the stage using the focus knob, be very careful not to raise the stage far enough. This could damage the slide, the lens, or even the microscope. So, pwedeng mabasag class. So be careful. Try not to. So I'm just teaching you the proper way of using microscope. But in your real practice class, sa iba, yung mga seniors nyo na may encounter, sasabihin sa inyo, idiretso mo na yan. Just start with OIO. Ganun ang sabihin sa inyo. But I suggest, pumunta muna kayo sa mga lower objectives para so you could find suitable fields na where you could view your suitable fields where you could view your cells na evenly distributed. Okay? So I hope you learned something from that. So let's go back on topic. Okay, there are 4 classifications class of your reticulocytes and they are based on their reticulum. So sa group 1, they would have a dense clump reticulum. So dikit-dikit class, kumpul-kumpul yung reticulum nila. So group 1, remember the word dense, clump, aggregated to class. Ito yung definition kanina ng reticulocyte nyo. That is group 1. The second one would be your group 2, which is characterized by extended network of loose. So when you say loose class, merong mga open spaces. Hindi sila dikit-dikit. It's not clumped together. So if you notice a picture, may mga spaces na onte. That is your group 2. So group 1, dense clump reticulum. Group 2, loose reticulum. Group 3 naman class are scattered granules with residual reticulum. So this time class, you would see a space and hindi sila connected. They would tend to be scattered, kalat-kalat. Minsan far from each other. So pwedeng may ganyan dito, may ganyan dito. Hindi sila connected class. Like this one. May space dito. Okay? So again, group 1, densely clumped reticulum. Group 2, loose reticulum. Group 3, scattered granules with residual reticulum. And your group 4 class, this is the one I was telling you about. This has your reticular dots, which are the scattered granules. So, yan. Yan yung sinasabi ko sa inyo, class. If you have 2 reticular dots, you would consider them as reticulocytes. Okay. Now, according to the NCCLS-ICH, states that reticulocytes must have at least 2 blue staining granules visible without fine microscope adjustment and located away from the cell to avoid confusion with Heinz bodies. So you have to make sure that it is away from the cell margin to avoid confusion with Heinz bodies. Now let's proceed to your calibrated Miller disc. So this is inserted in the eyepiece to allow rapid estimation of large numbers of RBC by imposing 2 squares. So dito class, you would have your calibrated Miller disc. Isa-slide nyo siya sa eyepiece. Now, it would look like a large square and meron siyang big square. Now, yung large square nyo, that is your A. The small square is your B. Yung A nyo class, itong area na to, dito na lang para mas makita na. Itong area na to, this is where you would count your reticulocytes. While itong small area na B, this is where you would count your RBCs. Okay? But there is a consideration. If you found, in case a retic is found on the square for RBC, it is now considered as both a retic and an RBC. So let's say class dito sa B, meron kayong nakitang reticulocyte. It would be counted as both RBC and reticulocyte. Okay? Litin ko. Yung large square, yung A, is for counting reticulocytes. Yung small square, which is yung B, is for counting RBCs. Now, in cases where you would find a reticulocyte on the small square sa B, you would count it as both RBC and reticulocyte. So, an example class, may nakita kayong 5 retics dito. Sa RBC, meron kayong nakitang 10. Sa RBC, may nakita kayong isang retic. What is the final count, class? Ano ang final count nyo? 6 ang retic. Ang RBC, ilan? Bakit 10? 11. Kasi nga, di ba, if you found a reticulocyte sa RBC square nyo, you would count it as both RBC and reticulocyte. Okay? Counted siya as RBC and retic. Okay? Now, there are different methods, class. Dito lang naman nagtatalo lang sila ng they have different supravital stain. So we have your BCB, rapid methods of Schilling, which uses BCB or also known as your brilliant Crescel blue. So yan yung BCB. Then we also have your Sabin method, neutral red, Janus green, Savards, BCB din, Osgood, NMB, Cook, Mayer, and Turin would use BCB as well. All right, let's now proceed to your computation. So medyo madami to, class, but this is very easy lang naman to ano. So your percent retics, so when you say percent retics yan yung dami ng reticulocytes nyo, that would refer to the number of retics in 1,000 RBC. So dalawa ang formula na pwede nyong gamitin. Number of retics counted divided by 1,000 RBC times 100 or number of retics divided by 10. So para mas madali, class, just use this second formula. So let's say ang example would be you found 12 reticulocytes. So you would get your percent retics by 12 divided by 10. You would get 1.2%. Normal value for adult is 0.5 to 1.5. Newborn, 2 to 6%. Then we also have your retics per cubic mm. So parang conventional lang to, class, ng WBC nyo. So ang formula is percent retics divided by 100 times RBC count in the million. So let's say ang RBC count ng patient is 4.1 times 10 raised to the 12 per liter. So this is the SI. Gawin nyo lang siyang conventional. So 1.2 divided by 100 times the conventional nito is 4,100,000. You would get, calculator natin. You would get 1.2 divided by 100 times 4,100,000. You would get 49,200 per cubic mm. Ang normal value, class, is 25,000 to 75,000 per cubic mm. Now, you would want this in reticulocyte number concentration. So basically, class, ito lang yung SI. And if you recall, you're just gonna multiply it by 0.001. So 49,200 times 0.001, you would get 49.2 times 10 raised to the 9 per liter. So normal value is 25 to 75 times 10 raised to the 9 per liter. Okay? So percent retics, number of retics seen divided by 10. Retics cubic mm, percent retics divided by 100 times RBC count in millions or in conventional. Retic concentrate, i-multiply mo lang. You just have to multiply the retics per cubic mm by 0.001. Then let's have your reticulocyte number fraction. This is equal to percent retics times 10. So kanina, ang percent retics natin is 1.2. So you just multiply it by 10. Ang only difference lang nito class is its unit. The unit is times 10 raised to negative 3 per liter. Normal value is 5 to 15 times 10 raised to negative 3 per liter. Then we also have your corrected W reticulocyte count. So you have your percent retics times hematocrit divided by normal hematocrit. So ang percent retics nyo is 1.2. Ang hematocrit dito class would refer to the patient. So let's say ang hematocrit nito is 18%. So then ang normal hematocrit dito class, this is a constant. Constant siya na 45. Meaning always 45 yan. So 1.2 times 18 divided by 45. You would get 0.48%. Ang baba class. Normal value niya is 1%. Then we would have your RPI, which is equal to CRC divided by the maturation days of retic. So how would you get the maturation days? Okay. You would look at the patient's hematocrit. So ang hematocrit ng patient natin is 18. So it would belong here in this range, 15 plus minus 5. So that is a range of 10 to 20. So from there, we could say that it has a 2.5 days. So ang CRC mo is 0.48 divided by 2.5. 0.48 divided by 2.5. You would get 0.19 as the RPI. Okay? Naintindihan, class? Okay, here's your RPI. This is also known as your shift correction. Now, during intense erythropoietic stress, such as your bleeding, in cases of bleeding class, the maturation time in the bone marrow may be shortened from the usual 3 days or 3.5 days to as little as 1 day, allowing the reticulocytes to circulate longer than usual in the peripheral blood. So class, if you recall, kapag normal ang hematocrit nyo, balik tayo dito. Tulad nito, normal yung hematocrit nyo. Ang sabi, di ba, 1 day siya magsi-circulate sa peripheral blood. So tama. 1 day lang talaga. But if na-notice nyo, habang bumababa, as your hematocrit decreases, longer stay in the blood. So sa 15 plus minus 5, it would stay in the blood for 2.5 to 3 days. Instead na dapat 3 days siyang nasa bone marrow, 3 days na siya ngayong nasa peripheral blood niyo. Okay, so here's an example again. So you have your compute the percent retics, retics and SI, retic number fraction, CRC, and RPI. So we have your percent retics. So ilan ang retics na binilang nyo? 47. So 47 divided by 10, you would get 4.7. Then you would get the reticulocyte concentration, also known as the SI. So get nyo muna class yung cubic mm niya, yung conventional. Percent retics divided by 100 times RBC count. So 4.7 divided by 100 times 5,200,000, you would get 244,400 cubic mm. Tapos, turn this into SI, multiply nyo lang by 0.001. You would get 244.4 times 10 raised to the 9 per liter. Then, retic fraction. Class ang shortcut dito sa retic fraction, just get the reticulocytes counted. Kunin nyo lang yung nabilang nyo na, then add nyo yung unit niya, which is times 10 raised to negative 3 per liter. Then CRC nyo class is percent retics, which is 4.7 times 20. So patient hematocrit 20. Divide nyo siya by 45. You would get 2.09%. Then CRC nyo class is 2.09. Maturation niya, since 20 siya, pasok siya sa 3 days. So you would get 2.09 divided by 3, you would get 0.70. Okay? And then a 30-year-old male was complaining of sore throat and Okay, iba na to. Alright, mamaya na yung problem. Kasi mag-quiz pa kayo sa ESR. Then variations in reticulocyte count. So physiologic would be seen in pregnancy, at birth, and in menstruation. Increased retics in pathological conditions such as your hemolytic anemia, lead poisoning, malaria, parasitic infestation, kala-asar, sickle cell, leukemia, and splenic tumor. Class, what parasite causes your kala-asar fever? Yan ang parasite. Leishmania. Give me the specific Leishmania, Rish Johnson. Starts with the letter D, as in dog. Okay, Leishmania Donovan. So you have your L. Donovan. Your kala-asar fever class is also known as your dum-dum fever. Okay. So you have decreased retics in aplastic anemia, acute benzoyl poisoning, chronic infections, and aplastic crisis of hemolytic anemia. Then sources of technical error: failure to mix the blood and stain completely, presence of refractile artifacts, increased blood glucose level, presence of Pappenheimer, Heinz, and Howell-Jolly bodies. Okay. So that ends